Asthma. Asthma is a condition that causes long-term inflammation in your airways. Inflammation makes them react to certain triggers, like pollen, exercise, or cold air. During these attacks, your airways narrow, swell up, and fill with mucus. This makes it hard to breathe or causes you to cough or wheeze. Types of asthma based on triggers include 1. Allergic asthma. When allergies trigger asthma symptoms. 2. Cough variant asthma. When your only asthma symptom is a cough. 3. Exercise-induced asthma. When exercise triggers asthma symptoms. 4. Occupational asthma. When substances you breathe in at work cause you to develop asthma or trigger asthma attacks. 5. Asthma-COPD overlap syndrome. When you have both asthma and chronic obstructive pulmonary disease. Types of asthma based on severity include 1. Intermittent asthma is a mild form of asthma where symptoms occur infrequently, typically less than twice a week, and are brief in duration. Individuals with intermittent asthma usually experience symptoms such as coughing, wheezing, chest tightness, or difficulty breathing during flare-ups, but have no symptoms between these episodes. Lung function tests are typically within normal ranges and daytime and nighttime symptoms are minimal. 2. Persistent asthma is a chronic respiratory condition characterized by ongoing inflammation and narrowing of the airways, leading to recurring symptoms like wheezing, shortness of breath, chest tightness, and coughing. It is classified into mild, moderate, and severe. Mild persistent asthma. Symptoms occur more than 2 days a week, but not daily, and may affect some daily activities. Moderate persistent asthma. Symptoms occur daily, and nighttime symptoms may interfere with sleep. Activities may be limited. Severe persistent asthma. Symptoms are frequent and can significantly interfere with daily activities and sleep. Lung function may be reduced. Symptoms of asthma include 1. Shortness of breath. 2. Wheezing. 3. Chest tightness, pain, or pressure. For cough. Causes of asthma. 1. Live with allergies or eczema. 2. Were exposed to toxins, fumes, or secondhand or third-hand smoke, especially early in life. 3. Have a biological parent with allergies or asthma. For experienced repeated respiratory infections like RSV as a child. Asthma triggers are anything that causes asthma symptoms. Common triggers include 1. Air pollution, factory emissions, car exhaust, wildfire smoke. 2. Allergies, pollen, dust mites, pet dander, other airborne allergens. 3. Cold air, especially in winter. For exercise, especially intense physical activity and cold weather sports. 5. Mold, even if you're not allergic. 6. Occupational exposures, sawdust, flour, glues, latex, building materials. 7. Respiratory infections, colds, flu, and other respiratory illnesses. 8. Smoke, smoking, secondhand smoke, third-hand smoke. 9. Stress, physical or emotional. 10. Strong chemicals or smells, perfumes, nail polish, household cleaners, air fresheners. Complications of asthma. Asthma can cause severe flare-ups that don't get better with treatment, is called status asthmaticus. This can be fatal if you can't get enough oxygen to your organs and tissues. Diagnosis. An allergist or pulmonologist diagnoses asthma by asking about your symptoms and performing lung function tests. They'll ask about your personal and family medical history. It can be helpful to let them know what makes asthma symptoms worse, and if anything helps you feel better. Tests. 1. Allergy, blood tests, or skin tests. These can determine if an allergy is triggering your asthma symptoms. To blood count, providers can look at eosinophil and immunoglobulin E levels and target them for treatment if they're elevated. Eosinophils and IgE can be elevated in certain types of asthma. 3. Spirometry. This is a common lung function test that measures how well air flows through your lungs. For chest x-rays or CT scans, these can help your provider look for causes of your symptoms. 5. A peak flow meter. This can measure how much your airways are restricted during certain activities. Treatment. 1. Maintenance inhalers. These usually contain inhaled steroids that reduce inflammation. Sometimes they're combined with different types of bronchodilators. To a rescue inhaler. Fast-acting rescue inhalers can help during an asthma attack. They contain a bronchodilator that quickly opens your airways, like albuterol. 3. A nebulizer. Nebulizers spray a fine mist of medication through a mask on your face. You might use a nebulizer instead of an inhaler for some medications. For leukotriene modifiers, your provider might prescribe a daily pill to help reduce asthma symptoms and your risk of an asthma attack. 5. Oral steroids. Your provider might prescribe a short course of oral steroids for a flare-up. 6. Antihistamines. Your provider might recommend allergy medications if you have allergic asthma. 7. Biologic therapy. Treatments like monoclonal antibodies might help severe asthma. 8. Bronchial thermoplasty. If other treatments don't work, your provider may suggest bronchial thermoplasty. In this procedure, a pulmonologist uses heat to thin the muscles around your airways,